New videos every day.
Today I want to talk to you a little bit about what chiropractic is, maybe a little bit about what it's not. And a lot of people think of chiropractic when they think of going to a chiropractor, they think of back pain or neck pain or something like that, maybe even headaches. But a lot of what chiropractors treat is other things with organ problems such as heartburn, reflux, indigestion, thyroid issues, constipation, those kinds of things. And today, I'm going to take you through a step-by-step procedure that would show you what it would be like if you went to the chiropractor and some of the procedures that we might use. One of the first things that we would do when you come to the chiropractic office is we take a detailed history. And this is very important because it's important for the doctor to know what your health issues have been up to this point. If you fell off the roof when you were 6 years old on your head, that's going to be significant for the chiropractor to know about these things. We also want to know how well your body is functioning overall. So in addition to you telling the doctor about your back pain, he may want to know about your digestive health, your heart, any heart issues, your cholesterol, and those kinds of things, so that we can get a total picture of your health. One of the first things that's going to happen when you come to the chiropractor is that you're going to get a full exam. Now, in my office, we do a full physical, orthopedic, neurological, and a chiropractic exam. Now, this is very important because the doctor needs to gather all the information that he possibly can in order to treat you in the best possible manner. So the first thing we would do is some of the obvious tests like blood pressure, pulse rate. We would check your reflexes, the biceps, the triceps, the patellar, and the Achilles reflexes. We would also check do a pinwheel test across your hands to check to see if the nerves are active. We would also do a whole host of different orthopedic tests that I'll show you later in the video. These help us to find out if there's any damage to the spine or the spinal nerves. We also palpate or feel of all the different muscles to find out if there's any spasms in those areas. That'll help us to tell what's going on in that area as well. We follow it up usually with some x-rays. And these are very, very important because they help the doctor to find out what kind of shape the spine is in. Is there a lot of arthritis in the spine? Is there some degenerative problems going on that the doctor needs to know about? Is the spine twisted or contorted in some strange fashion that would lead to this problem? Or is there something maybe even more serious, some tumor or cancers that need to be identified before any treatment is done? After the examination, we're going to take all of the information that we've gathered and we're going to sit down and come up with a solution to the problem. After we've reviewed the x-rays and we've reviewed all of the results of the examination, we'll actually have you come back to the office and sit down and discuss your case with you in detail. We'll actually show you your x-rays as well so that you can see with your own eyes what the problem is, and then the doctor can explain to you how we're going to go about taking care of your particular problem. Each problem is different and each treatment program is different depending upon what we found in the examination. You'll also notice in this part of your spine, it looks pretty straight through here, but when we get up to this area, it's very, very crooked. So again, you're having some problems up in that upper part of your back, and that's why you're getting these knots and problems up in the shoulder areas there. If you notice the spine from the front, it's supposed to be straight, all right? Mm-hmm. But from the side, the spine has these curves in here. And again, that's what gives your spine the ability to absorb shock or stress. You've got 24 of these movable bones called vertebrae here, and 33 pairs of spinal nerves that come out from the spine. Now, in your spine, if you notice where this nerve comes out, there's a big hole there, an opening so that the nerve can come out. But in your spine, the vertebra is actually shifted out of place and is putting pressure on that nerve. Okay? Take your little bitty finger for me, stick it in that hole, pretend that's the nerve that's in your spine. Yeah, see how this moves out of place? Ow, sorry, I hope I didn't hurt your finger. But that's what's happening in your spine. And that's what we call a subluxation. And when a person has a subluxation, it's going to interfere with that ability of that nerve to conduct the proper information across that nerve. What I'm going to be doing through the course of my treatment is gently moving that vertebra off of the nerve, restoring that normal nerve flow so that that stomach problem that you've been having should be getting some relief in short order. Also, that neck and back problem that you're having, that again should be helped dramatically by this. After we've gone through all of the different findings from your examination, it's time to begin the treatment. And the main treatment of a chiropractor is what we call the adjustment. The adjustments actually feel very pleasant, unless there's an area of severe pain, which in that case it could be a little bit unpleasant, but usually the doctor will not put the patient through any kind of unnecessary pain that the patient can't handle. The adjustments usually consists of relieving pressure from the spine. When the spinal bones get contorted or out of place, they can generally put pressure on the spinal nerves, which can go on to cause muscle spasms, pain, and swelling in that area. So the job of the chiropractor is to gently move the vertebra off of that nerve. When that happens, oftentimes the patient will hear a little clicking noise, and oftentimes that clicking noise is accompanied by great relief. Turn this way, just let that relax. Good. Good afternoon. Once the pressure is off the nerve, the body can start to heal. The swelling can start to go down, the pain will start to diminish, and the person will start to return to health. Sometimes this procedure needs to be repeated several times in order to get the nerve completely in the proper place. One of the other tools that the chiropractor normally uses is physical therapy. And this is of a great benefit to the patient because it provides a lot of relief from the pain they're experiencing. We use things like ice and heat and an electrical muscle stimulation, which helps to stimulate the muscle to reduce the spasm in that area. It also helps to bring blood flow to that area, which helps to move all of the damaged tissue out of that area and bring a faster and more rapid healing response. The chiropractor oftentimes uses a roller table also, and that roller table goes up and down the spine, providing the patient with a lot of relief, and it actually feels very, very pleasant as well. Many of my patients are often very, very surprised, and pleasantly so, that chiropractic can treat such a wide variety of things besides just back pain. And the reason that is because chiropractic actually works with your nervous system to improve it, to take pressure off of it, to restore it to its normal function. And your nervous system is what controls every single cell, organ, and tissue of your body. So by restoring that, we can oftentimes improve the function of the stomach so that digestion's better, improve the function of the heart so that the heart is working better, improve the functioning of the whole body. The person can get a great deal of relief and be very surprised at the results.